Thank you for listening in to CLDF Chatter. To give you a quick overview, CLDF is a national charity which supports families whose child has a liver disease. My name is Joanne Taylor and I am the Information and Awareness Officer for CLDF. Today we'll be talking about neonatal jaundice and the importance of the early identification of liver disease in infants. I'm going to be joined by two special guests. The first is Gemma, whose daughter Isabella was diagnosed with a liver condition called biliary atresia. Then I'll be talking to Michelle, the Head of Children and Families Services at CLDF. She'll be talking to us about identifying neonatal jaundice and the support that CLDF can offer. I'll also be providing information on CLDF's National Yellow Alert campaign. This is a campaign aimed at raising awareness of the early identification of liver disease in infants. So before I speak to Gemma and to Michelle, I want to give some information on biliary atresia and liver disease in infants. Biliary atresia is the most common liver disease in newborns. It is rare and happens when bile ducts form abnormally or when the bile ducts are inflamed or obstructed. This leads to a blockage of bile flow from the liver. Babies who have this condition need a Kasai procedure to re-establish bile flow. The procedure is not a permanent solution in most children, but without it, most will need a liver transplant early in life. It is very important that biliary atresia is found early so that infants can be treated as soon as possible. The main indicators for biliary atresia are prolonged jaundice, plus abnormal stool and urine colour. Today I am speaking to Gemma about her experiences of diagnosis with her daughter Isabella, who was born with biliary atresia. Hi Gemma, thank you so much for joining me today. Can we start by hearing about when Isabella was born and about your journey with her in those first few months?
Yeah, so when Isabella was born, we had the opportunity to stay in hospital overnight because Isabella was learning to breastfeed. And in that time, over that night, she actually turned jaundice, but they scanned her and she was below the levels for any intervention. And I had no idea that jaundice was a problem. So I knew like babies are born with jaundice and it's just a thing that babies get. I had no idea of the long-term implications it could have actually caused and how serious jaundice could have been.
So what happened from that point?
Isabella's weight was being monitored because she was losing weight, but they weren't too concerned because her levels weren't too low, and all breastfed babies lose a certain amount of birth weight. I said she kept feeding a lot, but they just said, oh, it's just cluster feeding. Put her by the window, take her out, try and top her up with formula if she's having too much. Oh, is her poo yellow? They didn't check it, but they said, is it yellow? And I went, yeah, it's yellow. I mean, I didn't realise there's different stages of yellow because you just don't know unless you're told. So yes, it was yellow. It wasn't white, but I mean, it definitely wasn't poo colour. It was very pale yellow. Oh, and then I think one day Isabella had put on a tiny bit of weight. So then they were like, oh, we're not too concerned, just straight from that pretty much.
So you were at home by this point and a little bit of time had gone by. So what happened next?
So then I took her to get weighed for the first time rather than them coming to the house. And because it was either like my first or second time weighing her myself, I just said, oh, can you help me? And this is where it escalated rather quickly. So if I didn't ask for this help, I don't know how much longer it was going to go on for. So she just goes, oh, do you think she's still jaundiced? I said, well, I don't know, maybe. I mean, she's 6 weeks old. She wasn't like yellow. She only ever had like a slight bit of jaundice, but it was obvious in certain lights. So they said, let me just go get the health visitor. And then this is where she goes, she's still a bit jaundice. I'll just do a referral because of her age to the jaundice clinic. And I said, okay, fine. I don't really know what it means, but okay, fine. And then they said, oh, okay, you'll hear from us either later on today or tomorrow. And then a week later, I still hadn't heard anything. And the health visitor was actually coming out that morning to come and check on Isabella. So bearing in mind, this is a whole week later. Coincidentally, as soon as that health visitor sat on my sofa, I had a phone call from the hospital. So I think they forgot to do the referral to the hospital. So then they phoned me and they said, oh, how old is she? I went, oh, she was like 7 weeks old now. And the woman on the phone goes, oh, okay, we don't normally deal with babies past the age of 4 weeks. So I just need to speak to a doctor and I'll call you back. So within 20 minutes, half an hour, she called me back. She goes, can you be here for 12 o'clock? So there's me just toddling off to the hospital by myself with Isabella, like, oh, we're just going to go for this checkup, like having no idea. And then they obviously did a wee sample and a blood test. We were still there at 9 o'clock at night. My partner had came directly from work to the hospital. They were obviously trying to figure out what to do. And it was like 10:30 at night, and they suddenly go, we're just going to admit you in overnight. You need to see the consultant and have an ultrasound. And then that's where it kind of was just like, oh, okay. Bearing in mind, nothing had actually still been said. It wasn't until like the following day, the consultant came round and was just like, we think it's this biliary atresia. It's really rare, but we're not sure if this is what it is. She needs an urgent referral to King's College Hospital in London to be seen by a liver specialist. Send photos of the poo, do this and do that. And then they'd spoken to the liver unit at King's, and then they'd prescribed all of this medication that I suddenly need to start giving her, all of this special formula that we need to start giving her.
Gosh, that's a lot to suddenly take in.
Yeah, so
A
it all
lot.
just suddenly changed within like a few hours, really. This was on like a Tuesday or a Wednesday. Maybe it was on the Thursday we went home. They said, oh yeah, you'll hear from King's. And then I think they phoned on the Friday and they said, oh, can you come in on Sunday at 4 o'clock to be admitted overnight just to run some extra tests. So we got there on the Sunday, we stayed overnight. And the Monday she had, I think it was bloods, and she had ultrasound. Tuesday she had a biopsy. And then Wednesday we went home. And then literally Thursday at 10 o'clock in the morning, so literally the next day, oh, can you come into the hospital for 4 o'clock today? Isabella will be going down for surgery tomorrow. And that was obviously for the Kasai.
Had they mentioned the possibility of a Kasai operation before that?
So actually, when we were in the local hospital, they were saying and stressing how important this surgery was, this Kasai procedure, and that she needed this before she got to 12 weeks of age and all of this. So by the time it happened for Isabella, she was 8 weeks and 3 days.
So that's later than some babies have the operation.
Later than ideally, obviously, the earlier it's picked up, the better it is. And it's just thinking, how much earlier could it have been picked up?
So the Kasai happened and that helped for a while?
3 months, 2-3 months maybe. And then, yeah, about September time it must have been. Isabella was rushed into hospital with sky-high temperatures, ascites, but she was actually pretty much a liver failure. She had sepsis, she had cholangitis, and it was really bad. She was really, really poorly. And they said if we had taken her in any later, it wouldn't have been much more that they could have done. And then from then, she struggled with cholangitis just repeatedly, portal hypertension. She had a massive bleed. It was literally like she was in hospital for like a week if that, maybe 2 weeks sometimes. And she'd be back in again anytime between 48 hours and 21 days. And then the same thing would happen again. We'd be home for a few days, a week or two maybe, and then we'd be back in. And it was just a constant battle, just going forwards and backwards, forwards and backwards.
And at the time, as far as information was concerned, did you want to know as much about biliary atresia as possible?
I wanted to know everything. I'd much rather know exactly what was going on, exactly what the circumstances were. It annoyed me when they kept information from you. And my mum was there when Isabella went for the Kasai, as well as my partner Alex, obviously, he was there. But Mum was looking online about it and came across the Children's Liver Disease Foundation.
And I suppose in the general hospitals as well, a lot of doctors and medical professionals may never have seen a case of biliary atresia before.
Yes, a lot of doctors and stuff that you see may not have even heard of it, never mind actually come across it. And a lot of the time when there was trainee doctors, because we were in there all the time, they would actually bring their trainee doctors in to see me and Isabella, and they would say, because it's just so rare to come across it, they were asking if they could see Isabella, speak to me about my experience and like have a look at her and stuff like that.
So after the Kasai and all the repeated trips into hospital, how long was it before Isabella's transplant?
It was only about a month and a half Isabella waited, but it was about a week to 10 days before the first lockdown. So we got the call, I think it was about 5:30 in the morning or something, saying that we've got a potential liver and that they were calling an ambulance to take us to the hospital. So we were there by like 7:30, 8 o'clock in the morning. So she had her bloods done, the chest x-ray and everything like that. They came in and they obviously spoke about the current COVID situation. And then it was about 10:05 at night. They said they'd obviously seen the liver and they said they're not sure if it's going to be too big. So they're going to go ahead, but they might needed to leave her open. And then they literally just walked in and went, right, you ready to go? And that was it. And it was just like, at like 10:10 at night, we just left that hospital room and just took Isabella down to surgery. And up until that point of you were in that operating theatre, it could be cancelled at any time for any reason. So then she had her 8.5-hour surgery.
So it was a difficult journey up to the point of transplant. How was the journey post-transplant? Was that tricky as well?
Yeah, she was 27 days in hospital. We weren't even home for a day and a half and we had to rush her back into our local. And then she was transferred back to King's. And then we were in hospital again, another 27 days. And for the next few months, she was still in and out of hospital. It was like we hadn't got any further than before transplant. And then she developed allergies to egg and milk. They thought it was like her gut had been destroyed by the amount of antibiotics she'd had. She started having random anaphylactics to general anaesthetic. And then she had early stages of PTLD.
Have things settled gradually?
Yeah, up until around she was about 3, I'd say. Now she's doing really well and it's just managing everything. She's outgrown her milk allergy. We went on our first abroad holiday last year as well, which was very exciting.
That must be a joy to see, because after everything you've been through, to see her doing the day-to-day.
Yeah, it's kind of like we hit probably about 3.5. It all just started to settle down, which is a long time, really. It's still like 2 years after a transplant, but it still takes that time to get there, and it takes a long time.
And I think there's a good message there about transplant, is that it's not a magic wand. There are still challenges after transplant.
It doesn't take away a problem, it doesn't fix a problem, it just replaces one problem with another problem. It just has to be managed slightly differently. But it's really hard because, yes, the transplant's meant to give you a better quality of life, which is the whole reason why they do it. Yeah, it takes time to get there. It really, really does.
So it's great to hear that there's been a positive outcome and that Isabella is now doing so well. But what's happened since, and has there been any learning from your experiences?
Yeah, after everything had settled down with like Isabella, because obviously we were just forced into like this absolute whirlwind, we put in a formal complaint, and then like a formal reply came back where there was 5 health visitors that had admitted to wrongdoing, and they apologized for everything that they did wasn't following protocol, and that they had missed everything, that they had had training, but obviously not the correct appropriate amount of training.
So are there any other things that you think could be done to help identify jaundice and the possible signs of liver disease in newborn babies? We do have the CLDF Yellow Alert campaign. How could that help as well?
It should be advertising like antenatal classes, and even just like on the triage wards and stuff like that, where you go to before you even have your baby. That's where it really needs to be. Because we did an NCT course, but not once did they mention about jaundice. But I think it should be a lot before you have your baby. Like I said, if I had known, I would have been taking her to A&E a lot sooner, because I would have known it was a problem. When I had Charlotte, so the second, her red book did have all the Children's Liver Disease Foundation's leaflets and stuff in it. So that was good to see. But a lot of people, it's just a load of rubbish, because there's so much stuff in there. It's just another thing.
Thank you so much for joining me today, Gemma, and for telling me your story. I'm now going to be talking to Michelle Wilkins, who is Head of Children and Family Services at CLDF. Hello, Michelle. Thank you so much for speaking with me today. We've been hearing Gemma speak about Isabella's condition of biliary atresia and the difficulties they faced as a family. Is it common that diagnosing biliary atresia does have challenges?
I'd say that it is something that parents do face. Obviously, liver disease in babies is rare, so reassurance around about that is important. It's not something that happens very often. And for a new parent, your wish, your desire for that child is for them to be well and for them to thrive and for there to be no issues. And things like jaundice, which is the indicator that potentially there could be something amiss with an infant's liver, is something that can happen to a lot of children, a lot of babies. And so there's that perception that it's nothing to worry about, which most of the time it's not. But there has to be that little bit of vigilance around about the fact that if it hasn't cleared, then further investigation is warranted. But I think the issue with rare liver disease is that the idea that it couldn't possibly be that, because it is so rare, is where the challenge arises. But the golden rule for something like jaundice is that if it goes past 2 weeks in a full-term baby and 3 weeks in a premature baby, then that jaundice should be investigated further, because it's what we would call prolonged jaundice. And also alongside that, there are other indicators that something may be not quite right in terms of a baby's liver, because you'd also see things like very pale stool, and urine in a newborn or a very young infant should be almost clear. But in a prolonged jaundice baby, where there are potentially issues with their liver, that urine would be yellow. And ultimately, for a parent and for a new parent, it's very confusing and it's very difficult, because you don't know what normal looks like. You don't know what to expect. There is no rule book for a new parent. So you have to take your lead from, say, your health visitor. So if they aren't particularly concerned, then you probably won't be particularly concerned. But if you've got any concerns, then stick to your guns. That's what we say to all of our parents. And the quicker that we can get a diagnosis for a condition like biliary atresia, the better, because there's a procedure that can be carried out by a surgeon that will really help so that the child's liver can start to function more effectively. And we know that the best way to treat this disease is to get the intervention in place as early as possible so that the liver damage isn't as severe as it could be if you wait weeks and weeks and weeks. And that is a matter of weeks that the liver disease can cause major damage. And if it does, then the outcome is transplant if the native liver just can't continue to function properly.
That's really interesting. And I was also wondering, what support can CLDF offer if parents do find themselves in this situation?
Absolutely. I think, first of all, when it comes to something like this, it's a complete shock. All parents believe that when they have their beautiful newborn baby, it's going to be perfect and everything's going to be fine. And then to find out that your child has something like this, it is a shock. But it's also disbelief because probably you didn't know that children got liver disease. You didn't know that their liver was at risk. And often for a new mum, it will be, what did I do wrong? Did I do something when I was pregnant? Is it something to do with me? And something like biliary atresia, there isn't a clear understanding of why some children's bile ducts don't develop properly in gestation. So it's nothing that a parent could have done differently. And it's not genetic, so it's not something that they can be tested for. But it is really just about trying to help our parents to make sense of what's happened. And I think a lot of that is in the understanding of what's going on and getting that information in a way that they can digest and understand. And it's not the complex medical jargon that tends to get thrown at people when they're in a hospital setting. The strength also comes in talking to people that understand, that know what that condition is, and work with other families that are affected by that condition. It's about having someone to chat to sort of lean on, to feel that, you know, when you're having a bad day, we're there just to help bolster you through that. And also to hear about eventually other families where their child has gone through similar experiences and has come out the other end and is dealing with this really positively. Those stories really help our families. We want to be able to help them cope with the financial burden of the impact that it has on relationships, how it impacts on other siblings, really anything that can be done to help them to cope with this really, really difficult thing that's happening to them. We work around enhancing well-being and improving their ability to cope with what's happening. And we just give them a safe space to say that this is rubbish and it's okay to feel that way and to feel really disappointed that you didn't have the experience that you expected to have, that it is a new normal. But you've got people that are here for you for the rest of your liver journey. As long as that you need us, we'll be there for you to help along the way. And that doesn't stop when that child has had their corrective procedure and is coming out the other end. It's when they go to school, it's when they go to university, it's all the way through, so that they get the right support and the right care to manage their condition effectively, but also not to let their condition stop them from doing the things that they want to do as they get older, and that the family learns to live with having a chronic condition, because there will be ups and there will be downs, and we're there sort of every step of the way with them.
That's brilliant. Thank you so much, Michelle, and thank you for joining me today. I've spoken a lot about the CLDF Yellow Alert resources today. All the resources are available on our website at yellowalert.org. They can be downloaded or they can be ordered in hard copy free of charge. This includes a prolonged jaundice protocol for healthcare professionals, plus a stool chart, leaflet and posters that can be put up on wards and in clinics. We also have a Yellow Alert app which can be downloaded from the App Store or from Google Play. Please don't hesitate to contact us if you would like any further information on prolonged jaundice, the Yellow Alert campaign and biliary atresia. You can call us on 0121 212 3839 or email info@childliverdisease.org. We look forward to hearing from you.